time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hello, pet lovers. It's another edition of PetSylvania. I'm happy to be with you. I'd like to thank our sponsors, and we'll start with Hills. They're the makers of the Science Diet line of premium dog foods and the prescription diet line available only through veterinarians that are disease-specific foods. These foods from Hills are scientifically researched and developed, and they're for dogs and cats. They don't branch out into other species. They are manufactured in the U.S. to the highest standards of cleanliness and purity. The products, formulas are stable, which is really critical. They have food that fit every niche, from their puppy to adult foods in the Science Diet line, to the all-natural diets, to a grain-free diet called Ideal Balance. They're products that you can trust. If we come back to that point that I made about stable formula, the government allows manufacturers of pet foods to change their ingredient list, and as long as the ingredients don't change positions, in other words, by the order of decreasing frequency from left to right, then they can substitute any ingredient they want, and that happens with a lot of the lesser foods. The super premium foods, like the Hills line, they have a stable formula, and so you can count on what you get in this bag and what you get in the next bag, and the bag after that are always going to be identical. Esplin Medical, they're the manufacturers of a really high-quality surgical scrub that are environmental friendly. It's like wearing pajamas when you wear the Esplin Medical scrubs. 55% bamboo, 25% cotton, 20% polyester, with an 80% content of natural fiber. They actually breathe and are far more comfortable. Compare them to the stuff that most people are forced to buy. They're 65 polyester, 35 cotton, and it's almost like wearing a burlap sack, and it doesn't matter how many times you wash them. You may purchase them. We carry the full line of Esplin Medical scrubs at Sylvania Vet. You can just stop in any time. There's a sample displayed. You can touch and you can feel. You can check out a sizing and go from there. Toledo Family Pharmacy also carries a limited line, and then online at www.esplinmedical.com. Elanco makes the next generation of heartworm, internal parasite, and flea control in a once-monthly pill. What could be more convenient than that? SVH clients are lucky in that we have the best prices in town on that. I was checking the net recently, and a similar price product that you pay for 6 tablets, you pay $88 at Sylvania Vet. Online at PetMed Express, it was $111.99, so $112. The online pharmacies don't give the rebates that the company provides because they're not authorized distributors, so you get a $10 rebate on top of that if you buy 6 from Sylvania Vet. And then Sylvania Vet, of course, is your one-stop shop for all your pet's needs. We have everything that you could possibly imagine, and we're constantly looking to add new services, add new products. We're extremely innovative and committed to providing the most advanced care that's available. At Sylvania Vet, you can call us anytime, day or night. We answer our own phones, so I would recommend that you call 419-885-4421 anytime, day or night, and get your questions answered. We also are community-minded. We do street pickup on Holland, Sylvania. We've provided watering fountains on the trail near Richards, at the Met Center in Wildwood Metro Park, and soon at the Rock Quarry to Sylvania out by the new water tower, because there's a great walking trail in there in the Fossil Park. And we also give a scholarship to a in-need veterinary student at Ohio State. So we're pretty proud of our involvement in the community. Why don't you become a part of that family? To get all those benefits, of course, you need to be a client. So we'd love to have you. We have 7 doctors, and so we're always available 70 hours a week. Speaking of 7 doctors, we'd like to welcome our newest doctor, Dr. John McCarty. He's a 2013 grad at the University of Missouri Vet School, did his undergraduate work as a Cincinnati Bearcat, grew up in the Dayton area. He brings superior intelligence and a great enthusiasm to our staff. Welcome, John. We're sure that the clients are going to love you. You need to come in and just stop in and say, I want to meet Dr. John. So he's going to start on Monday. We're really happy to have him. Small breed dogs, mostly, but large breed dogs also can have kneecaps that don't ride smoothly and properly in the groove in their knee. That groove is called the trochlea. When that happens, it tends to, in the small breed dogs, it tends to slide out and to the inside of the leg. And a lot of the small breed dogs, sliding kneecaps, ectopic patellas, whatever you want to call them, dislocating kneecaps. And a lot of times, nobody has a clue. The dog's not lame. There's no problems. Difficult to worry about that. But there is something that can occur when a dog has ectopic patellas, and that increases the risk of a rupture of the anterior cruciate ligament. And so you can justify, even if the dog is not lame, once it's fully matured and all of its growth plates are closed, you can justify going to surgery and stabilizing those kneecaps and getting them in place. Sometimes it requires deepening that trochlear groove because it isn't properly formed. Other times, in addition to that, we have to transplant a bone where the ligament of the patella attaches to the lower leg. We have to move that a little bit so that everything lines up nice and straight. And then we do that, the kneecap stays in place, and the knee and the leg is much more stable. I saw a dog today that we had done that surgery on about a year and a half ago. Knee felt great, nice and stable, nice and solid, and we were checking it out for other problems, and fortunately we didn't find any other problems either. So those are all good news. This dog is going to do really, really well. Yesterday we had one of those, I can't believe it moments. Client rushed in Layla. Client has twin babies. And Layla had swallowed, she was sure had swallowed a pacifier, a binky. And we took an x-ray, and lo and behold, we saw a binky. Matter of fact, we weren't sure how many we saw. So we went, the first step is to try to get the dog to vomit the object up. Didn't happen. And so then the next thing we try to do is we try to go in with our flexible endoscope and grab a hold of it and remove it. The trouble is that those little flanges on the binky that sit up against that baby's lip, they're pretty wide. When you're trying to grab a hold of the binky and then pull it back up the esophagus and out of the GI tract, it just doesn't want to fit, going the wrong way. So we ended up going to surgery on this dog yesterday afternoon. And we found not one, but we found an even dozen binkies that were in this dog's stomach. The owner was completely astounded. She had no idea that she was even missing that many. Today, Layla's doing great. Is recovered very nicely from having to have her stomach open up and have a binky removal performed. One of the things, you got to be careful, stuff that's probably has milk on it, has saliva on it. Dogs are interested in those kinds of things. So, take that as a fair warning. Keep that stuff up out of sight because they're too big for a baby to swallow, but they're obviously not too big for a dog to swallow. If one of them had gotten out of the intestinal tract, then we would have been into a much more serious condition of an intestinal obstruction. It's time to take a break, and we'll be back on the other side. There was an article in Veterinary Practice News about a couple of veterinarians nationally that provide online pet care advice, medical advice to clients for a fee. I would tell you that I think that that's a horrid idea, and I quite frankly think it's a waste of money. But the only reason that they could possibly have a market for those services is because most veterinarians are not doing a good job explaining problems, explaining diagnoses, and so for us, that's never a concern at Sylvania Vet, because you can call us anytime, day or night. Doesn't matter. Oh my gosh, I have a question about that medicine that was prescribed for my dog when I took it home. Well, you call at 2 a.m. because you're worried about it and you can't get to sleep, and one of our technicians answers the phone, looks at the record and answers your questions for you and relieves you, and you haven't had to pay a nickel for that. But why else isn't it a bad idea? Well, the veterinarian online does not obviously have an opportunity to do a physical exam. They really have no knowledge of the pet other than what you're maybe able to tell them, and you're going to have a limited amount of time to speak with that person online, or you may not even be speaking. It may all be done by email. You don't have a chance talk about previous history, and certainly that online veterinarian has no opportunity to see previous history, to see previous lab work. They're probably not going to have access to the lab work. They're not going to have access to the x-rays or an ultrasound that was done. There's only about a 1 in 50 chance that they're actually licensed in the state of Ohio, which means that without a patient-client-doctor relationship, they cannot give you advice. They cannot make a diagnosis, and they cannot prescribe medication. So they couldn't even they wouldn't be licensed in the state, so they couldn't call a pharmacy and order medication. The one veterinarian that I saw for one consult, the cost was $59, and I think that's absolutely ludicrous. So remember, 24/7, 365 in-hospital staffing with a technician and a doctor on call. You do not need an online source for pet information. General information or specific information about a case, drawings and pictures, go to our website, www.sylvaniavet.com. Go to our medical library. There's a ton of information there. Again, you do not need an online veterinarian to help you. One of the pharmaceutical manufacturers in veterinary medicine is called Novartis. They're also, of course, on the human side, but they have different divisions. So Novartis Animal Care is the company that made a once-a-month heartworm medication called Interceptor. Last year, Interceptor and all the related products, which is Sentinel, made by Novartis, they stopped manufacturing those products because there was a contamination issue in the plant where this product was made. From the Novartis standpoint, it had nothing to do with either of their products. In other words, the contamination that occurred in the plant was on the human side, but the animal side got shut down as well. So they didn't have either of those products, and clients were without those products for an entire year. Well, they've now come back, but they've only come back selling Sentinel. And Interceptor has been dropped, and so it's no longer available, which I think is a real shame, because Sentinel provides Interceptor, but it also provides Program. Now, Program is a once-a-month product that is basically a flea birth control product. It actually sterilizes the flea eggs once an animal is bitten by that flea, and that flea is laying eggs. The flea control product in Sentinel does not do anything to kill fleas. So as a result, I really think it's pretty much a worthless, overpriced product, because you're paying to get two ingredients when the only thing that you really want and should have is the heartworm preventive that's in the Sentinel. If your animal's been on Sentinel and you say, well, I've never had fleas, then the answer to that is you've never had fleas, because for Sentinel to work on a flea control basis, your pet has to have fleas, and it's basically an environmental treatment. So I think it's really pretty nice that you're providing birth control for the fleas that your pet's carrying around, but it seems ludicrous to me to spend money for that product and not get any adulticide protection. In humans, we call it dementia or Alzheimer's. In animals, when it affects dogs and cats, we call it cognitive dysfunction. But basically, it's all kind of the same. It's deteriorating brain function. It's a clinical disease. It's not just aging. It's not senior moments. It's truly a change. Truly a change in brain chemistry, and brain function. The onset of the signs in Fido or Fluffy can be slow and subtle, and most people will just chalk it up to their dog or their cat getting older. A study that was done in Australia showed that of aged dogs over 12, 14% of those dogs showed some signs associated with cognitive dysfunction, but less than 2% of them was it ever diagnosed or addressed. By 15, another study showed that 41% of the dogs and cats will have at least one sign of cognitive dysfunction. So what are a few of those signs? Well, changes in housebreaking. They lose their training. They've always been trained, and all of a sudden they're not telling you anymore. All of a sudden they're waking up in the middle of the night and pottying. Those are definitely changes that we would associate with cognitive function, assuming that there is not a urinary tract infection or other disease. Social interactions change. They want to be more alone. They're not as family oriented. They don't want to come to you when the door opens, even if they can hear. They act a little spaced out. They may go stand and stare at a wall for a while, and those are all signs that we can associate with cognitive dysfunction. One of the things that you think about is if your pet's on a long-term medication, particularly a mood-altering drug for behavior reasons or something like that, as they age, their metabolism changes, and it may be building up, and maybe the animal is just drowsy as a result of that. But on top of that, I think then once you eliminate that as a possibility, once you eliminate through lab work that there's something else going on, liver problems, other kinds of things that can cause behavioral changes, then we want to go to treatment. And treatment starts with a diet. And there's two diets that are specifically designed for cognitive dysfunction. One is a diet made by Prescription Diet, the Hills people, called BD, Brain Diet. And then Purina One makes a diet called Vibrant Maturity Senior. Both of those have been proven to be beneficial. When that alone doesn't do it, then there's some homeopathic products, and you can use a product called Nutrix. We carry Nutrix. It's working really well for us. SAMI in a variety of forms, Denisil being the product that we use, and another product called Senalife. All those are homeopathic products. And then there's a pharmaceutical called Enalapril that we might be able to use. So once they've responded and you give it about a month, then you start working on retraining some of the behavior. Saw a dog today, actually, and I had written this part of the program before this, but it's a female dog with irritation around its vulva. And what happens in these situations is a lot of these dogs are older and obese, and as a result, the vulva gets kind of buried up in the obese tissue and the redundant tissue of the hiney, and it creates a place that traps moisture. So when they urinate, it never completely dries. And in this case, this dog had an abscess of one of the lips of its vulva, actually, and it was really painful and very messy. Well, we try treating that medically, but it's an ongoing kind of hygiene situation that we have to follow. And so sometimes we talk about doing surgery on that area, and we do that with a procedure called an episioplasty. It works really well. We eliminate a lot of that redundant tissue, and then as a result, we're able to keep that area dry, and it's healthier. The dog's more comfortable. We see dogs with these problems. They'll be scooting along, but they won't be scooting on their anus because they have parasites, or they have anal sacs that are full. They're scooting along on their crotch because their vulva is really irritated and really uncomfortable. It can be very, very painful for the dog. It's time to take a break, and we'll be back. Well, we're back to finish up, and I've got a couple of things to remind you about. On Wednesday, June 20th, the next Sylvania Veterinary Hospital Animal Health Seminar is going to be held at the office, 4801 Holland, Sylvania, at Haroon, 7:30. It's a Wednesday night. We're going to go about an hour and a half, and we're going to be talking about how to read a pet food bag. I think that's information that every pet owners should know. And if you do that, then you can look more critically and listen more critically to TV ads, which tend to be just grossly inaccurate. And then we're also going to talk about 6 nutritional myths that have been perpetuated on the internet. And so we're going to try to cover that. And then there's going to be a short introduction by the Hills representative on metabolic diet, which is a game changer as it comes to weight loss. Saturday, today, from 9 until 1, so it's almost over, and I'm sorry that we didn't get this information to you sooner. The Metro Parks is having Metro Barks at Swan Creek Metro Park, which is the entrance off of Airport Highway between Reynolds and Byrne. So if you're out and about and you want to stop by, there's going to be a lot of activities going on, a lot of fun. It's my understanding that the Blade is going to announce the winner of Pet Idol at that event, and that could be a lot of fun for you to see which of those animals, if you've been following Pet Idol on the internet or if you've been following it in the Blade. So I want to thank our sponsors, Esplin Medical, the makers of 80% all natural fiber surgical scrubs, compared to the much higher priced Grey's Anatomy scrubs. I did a little research on that. Grey's Anatomy scrubs are made of 77% polyester and 25% rayon. That means that they are all petroleum-based artificial fibers that are used. They cannot breathe because those natural fibers do not breathe. And so that's an advantage. And plus which they are substantially more expensive than Esplin Medical scrubs. So check out Esplin Medical scrubs at Sylvania Vet, Toledo Family Pharmacy, and online at www.esplinmedical.com. Hills, the makers of high quality, scientifically formulated and based diets. I want to the prescription diet line, of course, therapeutic diet, metabolic diet for weight loss. We talked about BD. They make diets for kidneys and for heart. They make diets for allergies. They make diets to actually treat cats for hyperthyroidism. It's called YD. Elanco, the makers of Trifexis, a pill given once monthly that prevents heartworm, helps prevent internal parasites, roundworms, hookworms, whipworms, and flea control, all in one once-a-month pill. And Sylvania Vet. Stop in for a tour anytime. That we're open, and we're open 70 hours. We're open 70 hours a week, including until 5 o'clock on Saturday. And there aren't many practices open beyond noon on Saturday. So you pay regular fees from noon to 5. Check us out, 13abc.com. Get connected. It's a great place to go and see. There's a 3-minute endorsement video on there. And then certainly our website's another great way to learn about Sylvania Vet. www.sylvaniavet.com. Our phone number, 419-885-4421. Our location, 4801 North Holland, Sylvania, at the south end of Haroon, just down the road from Flower Hospital. With that, there's only one greatest pet, and it lives in your home. Thank you, pet lovers.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.